report pendant and I reports patient general impression. When I'm immobilizing a patient, I also wear an N95 mask. Hello, my name is Neo, and one of the EMT here. I'm going to help you. If possible, I would put my patient into a high flow, and I would obtain a set of vitals and SpO2, and I would assess by the lung sounds. Indication for Cpap: the PT is less 8 years old. History of CHF with pulmonary edema, and one of the more following for indication for Cpap is pedal edema, which is swallowing of food, autopenia, anxiety, and suddenly a shortness of breath. PT has signs and symptoms, which acute of asthma attack, pneumonia or COPD exacerbation, acute of respiratory, if the patient is unresponsive, and a DNR PLST, sleeping comfort care is enforced. Cpap. The absolute contraindication, do not use. The Cpap contraindication is no less than 8 years old. Severe LOC, alert level of consciousness, respiratory or cardiac arrest, nausea and emesis, unable to maintain patient airway, or increased risk of aspiration. And one last thing is major trauma, especially head injury or significant chest trauma. Pneumothorax. And I forgot one last thing is systolic blood pressure below 90 mmHg. And one last thing is, for patient having COVID, we'll always use Cpap. Contractilation involving Cpap. History of pulmonary fibrosis, decrease of LOC, inability to tolerate mass after the first minute, and patient that have COPD, chronic obstinate pulmonary disease, which is have a experience and exhaustion of the condition. Okay, when using a Cpap, make sure you have the mask fit on to the patient. Make sure it's secured. So this one have a issue. This one might be broke. Okay. Yep, we got an issue here. This one broke. Okay, try our best to put it on. Okay. Good. Make sure I select the right mask for the patient, and I'll connect the fixed flow generator. Put the intubation. holding Cpap bulb by volume of 7.5 cm.
Does it have this port? Does it have this port?
Okay, and I'll put it in this port. I'll just turn it off because I don't want to waste any oxygen. And I'll make sure there's no leak on the mask. And I'll ask the patient how does it feels and breathe normally. I would reassure for positive indication that when taking vital signs and every 5 minutes. And I will check for SpO2 and 92% or greater. Reassuring lung sounds, decreased respiration rate to normal range. Decreased heart rate to normal range, decreased BP to normal range. I would use my stethoscope to listen to the lung sounds on anterior and posterior chest regions. I would document the use of Cpap and the patient response to the PCR. If the patient does not improve, we would use the BBM or have the paramedic make intubation if necessary. I would assure the receiving hospital notify that the patient was used on Cpap. Thank you.